Hello everyone, I'm Xianghao Zhan from Department of Bioengineering from Stanford University. Today is my great pleasure to give you the presentation of our project, Filter Drug-Induced Liver Injury Literature with Natural Language Processing and Ensemble Learning. The drug-induced liver injury, or what we also refer to as DILI, has become an important cause of liver injury. It is defined as the unexpected adverse reaction to drugs because the liver plays a key role in the metabolism of drugs and other cyanobiotics. The severity of the drug-induced liver injury can be different among different patients because of the interactions between the genetics and the environmental factors could be different among different people. Although most patients recover from the drug-induced liver injury, the DILI cases may lead to acute liver failure, and approximately 75% of the idiosyncratic drug reactions can result in liver transplantation or even death. And therefore, the drug-induced liver injury has become the most common reason that rejects the promising novel drug candidates. The severity of the drug-induced liver injury consequences calls for a better prediction of DILI. However, the majority of the DILI results come from the clinical practice, and all the experimental studies have been shown in the free text formats in the publications. And conventionally, the scientific publications need to be manually checked and processed. Recently, the rapid development of natural language processing technology has enabled data mining applications based on free text. It also makes it possible to process the scientific publications automatically and label the publications with the drug-induced liver injury results and facilitate researchers to fast filter the literature. And this may also be the reason that CAMDA released this challenge for us to develop the NLP tools to classify the drug-induced liver injury papers, which we refer to as the DILI positive papers, for the potential faster processing of the potential drug candidates. As for the dataset, it contains the PubMed papers with the drug-induced liver injury results, which we refer to as the DILI positive results, and also the unrelated papers, which we refer to as the DILI negative papers. And this data set has been curated by the FDA experts. And the data set contains more than 14,000 cases for the positive cases and more than 14,000 cases for the negative cases as well. But only 50% of the data has been released in the first round of model development and model validation process. And the other data were stored in the holdout validation set, where we cannot use directly in the first stage of model development. And the data are given as CSV files with the titles and the abstract related to each paper. And what must be mentioned here is that not all the paper publications have both title and abstract. Some of them only have title and some of them only have abstract. And here, for the holdout validation sets, in the first data set, we have 14,211 samples with a label mask to test our model's performances after we submitted the model predictions. And for the second holdout validation set, which we also refer to as the additional holdout validation set, it contained 2,000 samples with abstract only to test the model robustness. And here I show a brief snapshot of this example of the CSV files and the examples of the cases. Here it includes the PubMed ID related to each publication, the title related to each publication, and the abstract related to each publication. As you can see, they come in the free text format with all the punctuations or different words in this format. And to begin with, we firstly preprocess the data. We firstly partition the data into 80% training data and 20% validation data. The training data will be used to develop our models and we also adopted a 5-fold cross-validation on the training data to tune the hyperparameters of the model we have used. And 20% of the validation data also come from the publicly available data released in the first round. And this part of data will be used to validate the models and used for the model selections. Based on the free text, firstly, we pre-process the data by lowercasing all the words to their lowercase format. And then we remove the punctuations, the numeric values, and also the URLs as well. And moreover, we have also removed the subwords that does not contain many clinical meanings here, such as the conjunction words and, but. And lastly, we have also adopted this word stemming by changing each individual words to their word stems. For instance, the word hepatotoxicity will be changed to its word stem, hepatotox. And with the stemming, we will be able to significantly reduce the dimensionality of the feature space. And here, what must be mentioned here is that we use the stemming as a hyperparameter and tunes it as in the model selection part in the 20% validation data. So we finally adopted the model with or without the stemming based on their performances on the 20% validation data. The whole process of this modeling and model validation was done in Python, and the data pre-processing part was done with the Python library Jensen. And after we processed the data, we reached to the step 2 for the text factorization. Here, we adopted different word-based text factorization algorithms and language modeling-based factorization algorithms. For the word-based text factorization algorithms, we adopted the backup words, the BOW, the TF-IDF, and WorldtoBack model. For the backup words model, it simply directly used the word count as the features. So it directly used word frequency in a specific text as the features for the text. And the TF-IDF further optimized the backup words algorithms by normalizing the word count. And it takes into consideration both the word count and also the frequency of the document which contains this word. And the WorldtoBack is based on the neural network. And we directly adopted 2 pre-trained biomedical WorldtoBack models trained by different researchers. And I will introduce these 2 models on the next slide. And lastly, we have also adopted the language modeling-based factorization method, which is a pre-trained bio-center-back model trained on the PubMed and Mimic3 dataset. And the vector space is in 700 dimensions. Here, for the 2 WorldtoBack models we named them WorldtoBack 1 and WorldtoBack 2. For WorldtoBack 1, it has been trained on the PubMed data, the PMC data, and the Wikipedia data. It modeled in 60 million terms in total, and the dimensionality of the feature space is 200. And for WorldtoBack 2, it has been trained on the PubMed and Mimic3 dataset. It also contains 16 million terms, and it was also modeled in the feature space of 200 dimensions. And here, after we got the text vectors, we use the Teasing to visualize the vectors of the features. Here, we use the TF-IDF and center-vector model as examples. The Teasing has been shown to be effective in visualizing high-dimension data because Teasing has been regarded as a non-linear dimensionality reduction technology, and we use it to briefly show the distribution of the DILI positive and DILI negative cases on 2D planes. And here we could briefly see that the positive cases and negative cases generally are separated on these 2D planes, which indicated that it may be possible and feasible for us to build classifiers to classify the DILI positive and DILI negative publications. And in this way, it may be able to enable the users to filter the DILI positive publications based on the titles and the abstract. And finally, and furthermore, in the modeling processes, I'm going to introduce 4 steps: the development of separate models, the development of ensemble learning model, the error analysis, and finally, the model interpretation. But before we go to talk about the separate models and ensemble learning models, firstly, I will briefly introduce the 2 protocols we use in the modeling process: the non-ensemble learning model and the ensemble learning model. For the development of the non-ensemble learning model, we directly partition the data released in the first round into 80% training data and 20% validation data. The training data will be used for the development of the separate models based on different text vectorization algorithms, and the validation data will be used to select the models. And for the ensemble learning models, we further partition the original 80% training data, and we partition the data into 60% training, 60% data to train separate learners based on different text vectorization algorithms, and 20% data to train a meta-learner that aggregates the predicted probabilities of different vectorization methods. And we still use the 20% validation data for the final validation of the model performances based on the ensemble learning models. And what must be mentioned here is that we use the logistic regression and random forest as the classifiers, and we also use the different models, the logistic regression and random forest, in the initial preliminary experiments of model development, and selected the best model based on their performances on the validation for each type of the text vectorization algorithm. And what also must mention here is that, as you can see, the ensemble learning models, they aggregate the predicted probabilities given by different models built on different text vectorization algorithms. And in this way, we can refer to this as a kind of decision level data fusion, where we directly use the predicted probability and aggregate them in the final meta-learner. And firstly, I will show the result given by separate models. And for the development of separate models, we use the 80% of the data to train the model and 20% of the data to validate their performances. And we adopted a 5-fold cross-validation on the training data for the hyperparameter tuning. And the hyperparameters included, for instance, the L2 penalty for the logistic regression model. And here, we show the best result for each of the vectorizers. And we show the area under the receiver operating characteristic curves, the accuracy, the area under the precision recall curves, and the F1 scores. And here we can see that the TF-IDF has become the most accurate model in terms of the 4 performance metrics: the area under the receiver operating curves, the accuracy, the area under the precision recall curves, and the F1 score. It outperformed the other 4 different types of text vectorization algorithms. And the 2 WorldtoBack models generally performed worse when compared with the other algorithms, and CenterVect performed the second best when compared with other algorithms, and it lagged behind the TF-IDF on its 4 performance metrics. Because we can generally regard the TF-IDF as the vectorization algorithm that optimize the backup words. So in the following discussion of the ensemble learning models, we did not discuss the backup word model because the performances has been completely covered by TF-IDF, and we regard the TF-IDF as the optimized form of the backup words, and therefore in the further discussion we will discard the backup words. And here we show the false positive and false negative results of the predicted by different separate models trained on different word vectors. And here we can see that for both the false positive and false negative predictions, there is the majority of the wrong prediction has been covered by different models. But meanwhile, we could also see that many of the models show the great divergence across different separate learners. For instance, the TF-IDF and the CenterVect models both show 5 different false positive cases, And for the false negatives, there are also different wrong predictions covered by different models. And this leads us to think whether ensemble learning could further improve the model performances by taking into considerations the predictions given by different models. And therefore, we can make use of the advantages of different models. And this divergence across different separate learners enable us and also motivates us to develop the ensemble learning models. And for the ensemble learning models, here we adopted full factorization models, a method, and 3 different weight ratios. The reason why we added 3 different weight ratios for the positive case between the positive cases and negative cases was because in real-world cases, in real-world applications, the DILI positive publication could be far fewer compared with the DILI negative papers because there are many different research fields in biomedicine other than the drug-induced liver injury. And that's the reason why we add different weights towards to let the model to focus on the DILI positive cases. And here we show the final 12 different models that will be used in the ensemble learning process. And here we show the TF-IDF to WorldtoBack models, the CAMDA models, and their respective, the optimized hyperparameters of the L2 penalty for these models are shown here. And they have been tuned based on the 5-fold cross-validation on the 60% training data in this case, because this is the ensemble learning protocol. And then we use the 60% training data to train the 20% to train the 12 different separate learners, and use the 20% data to train the meta learner that aggregates the predicted probability given by different separate learners. And we added the ensemble learning models performances to this table and show their performances. And based on this table, we could see that the TF-IDF and ensemble learning models generally shows the similar performances. The TF-IDF shows the highest area under the receiver operating curves, but it is only slightly higher than the ensemble learning models. And both the TF-IDF and the ensemble learning models show the same accuracy, the area and the receiver area and the precision recall curves, and at 1 score, which generally show that these 2 models are performing best on the separated 20% validation data. And therefore, we tested the TF-IDF models and ensemble learning models in the holdout test data. And meanwhile, we have also shown the performances in a visualized way by plotting the receiver operating characteristic curves and the precision recall curves. And here, for the first on the left, we show the receiver operating characteristic curves with the x-axis representing the false positive rate and y-axis as the y-axis as the true positive rate. And we could see that the orange line, which represents the TF-IDF model, and the brown line, which represents the ensemble learning model, are the highest, showing the highest performances, with the line covering other models. And for the precision recall curves, the x-axis represents the recall and the y-axis represents precision. And here we could see that the TF-IDF model and ensemble learning model are also performing the best. And as we move forward to test the performances of our 2 models to best performing models on our validation set and test them on the holdout test data, we have shown the performances in this table. And here we use number 1 to denote the holdout data, and number 2 to denote the performances on the additional holdout data. For the models, for the model performances on the holdout dataset 1, we could see that the ensemble learning model and TF-IDF model reach the same accuracy, but the ensemble learning model shows slightly higher F1 score and precision when compared with TF-IDF, but the TF-IDF shows slightly higher recall. So generally speaking, the ensemble learning model was the better model on the holdout dataset 1. But if we move to the additional holdout data, which only included 2,000 1,000 samples with abstract only, the TF-IDF outperformed the ensemble learning model with a higher accuracy, the higher F1 score, and higher precision. And this result generally indicate that on both the dataset 1 and dataset 2 for the holdout dataset, the TF-IDF and the ensemble learning model perform very well. But the TF-IDF model may be preferred when the abstracts are there and without any titles there for the data in holdout dataset 2. And for the third part, we analyze the error and analyze the wrong predictions given by different word vectors and different models based on different text vectorization algorithms. Firstly, we show the confusion matrices given by different models. And here we could see that most models perform really well, with the majority of the cases clearly landing on the diagonal lines in the true negative or the true positive predicted region. But for the false negative and false positive cases, the different models show different performances on the validation data. Here, we show that the TF-IDF model was the best model in terms of the false positive prediction. It has the fewest false positive predictions. And for the ensemble learning model, it shows the fewest number of false negative predictions. And these characteristics may also enable users to adaptively choose the final model in their applications based on their requirement of the false positive or false negatives. And lastly, we have also interpreted our models because the model we use in this study are generally interpreted models such as the TF-IDF, the word-based models. So we can directly interpret the important words for the TF-IDF to make decisions to predict a specific text to be the DILI positive or DILI negative. And here, we perform the bootstrapping on the 80% training data for 1,000 times and calculated their coefficient in the logistic regression and ranked them by their mean over the 1,000 experiments with bootstrapping. And here we show the top 10 words for the positive cases and top 10 words for the negative cases. For the positive cases, we could see that such words like the safety, the hepatotox, the liver, the hepat, the toxic could clearly show this kind of clinical meaningful things related to the drug-induced liver injury. And here, because for this TF-IDF, we use the word stems. The word safety may refer to the safety, and the hepatotox refers to words related to hepatotoxicity. And from this example, we could see that this model is fully interpretable in finding the important words that are closely related to DILI, the drug-induced liver injury. And for the negative cases, we could also see that such words like the rat, the vaccine express cell, these words are the indicators of the DILI negative predictions. And it is also clearly meaningful because they may be closely related to other fields of research in biomedicine that are not related to the drug-induced liver injury. So this analysis show that our TF-IDF models could be fully interpretable based on important words, and this could be very helpful because the clinicians usually attach great significance to the interpretability of the model decision-making process. And furthermore, we have also interpreted the contribution given by different separate learners in our meta-learner, which is in the ensemble learning process. And here we also bootstrapped on the 20% meta-learning training data for 2,000 times. And here we show the contributions of the 12 different separate learners from TF-IDF, WorldtoBack 1, WorldtoBack 2, and CenterVac models. We show their contributions in terms of the coefficient in the logistic regression when we aggregated their predicted probability with the final layer of the logistic regression. And here we could see that, generally speaking, the TF-IDF models and the CenterVac models are contributing more Yeah, and this has also been shown in our previous results that the TF-IDF and the S2V, the CENTIL-WorldtoBack models, are generally performing better on the validation data, on the 20% validation data. And they are also contributing more in the final ensemble learning models. And meanwhile, the two WorldtoBack models are contributing less when compared with the TF-IDF and CENTIL-WorldtoBack model. But what must be mentioned here that all the coefficients in this regression, in the final aggregation of their predicted probability of the ensemble learning models are positive. All the coefficients are positive. That indicate that all of these separate learners are contributing to our final ensemble learning models. Yeah, this is the interpretation of our ensemble learning models by showing the contribution by different separate learners. Well, in this study, for different natural language processing, text factorization methods were used, and they are used to vectorize the scientific publications based on their PubMed title and abstract. And the logistic regression models were built based on the text vectorizers, and finally, ensemble learning was also used to model and to predict the drug-induced liver injury-related publications out of the irrelevant publications. The TF-IDF model and the ensemble learning model reached the highest classification performances in terms of the four metrics: the accuracy, the area under the receiver operating characters curves, the area under the precision recall curves, and the F1 score on the validation set. And for the additional and the holdout test data, both models show high classification performances on these two holdout data sets. And additionally, the TF-IDF model is also fully interpretable with important words for making the positive predictions and the negative predictions. For the positive predictions, for the positive important words, they show meanings clearly related to drug-induced liver injury, and the important words for making the negative prediction are not directly related to the drug-induced liver injury. Because the DILI, the drug-induced liver injury, has been regarded as the main killer of prospective new drug candidates because it may cause acute liver failure and even death. But so far, most DILI research results are in the free text format in scientific publication. The models developed in this study may be able to enable researchers to fast filter the DILI literature without the time-consuming manual work to check and read the publications. Although the models developed in this study have shown good classification performances, there are limitations that can be further addressed in future studies. For example, we haven't tested the transformer-based models such as the BERT, the GPT-2 in this study, because the current classification performances based on these relatively conventional NLP technologies, the TAC vectorization algorithm, has been satisfactory on the validation set. And in the future, for the future studies, including a pre-trained transformer-based model such as the BERT in ensemble learning, may further improve the classification in performances, although that may be at the sacrifice of the full interpretability of this model. Well, and finally, I would like to appreciate the help I got and assistance from my collaborator Fanjing Wang, who is now a master student in University College London, and his research interest is in drug delivery, AI-infused manufacturing, and biomaterials, and also the great support from my PI Olivier Givard. And he is an expert in machine learning, biomedical data fusion, and the cancer biology. Yeah, that's all of the presentation. Thank you very much for the privilege of your time.